Hello. Today I will demonstrate how to clean and check a hearing aid to avoid sending it in for repair when it could potentially be fixed in clinic. We will run through a 5-step troubleshooting checklist. First, otoscopy. Second, visual inspection. Third, cleaning. Fourth, replacing parts. Fifth, listening check. When a client comes in with a hearing aid that is not working, you'll want to look in their ear to determine if the reason they aren't hearing as well is because of some obstruction in the ear, such as wax, a dome, drainage, or a middle ear issue. If you have been trained to remove wax or a dome, you may proceed. Otherwise, refer the client to an ear, nose, and throat physician. Tip: always look in both ear canals. You never know if there's an issue on the other side. Next, we'll visually inspect the hearing aid. Put on gloves or grab a tissue and look at the hearing aid. Is there any broken part or obvious wax? You'll cup it in your hand and listen for feedback. This gives us an idea of if it's working. Next, we'll clean the device. Let's start with the right. So we'll take an alcohol-free cleaning wipe and clean the body of the instrument and the receiver and ear grip. We'll take off the dome and then use our brush to clean the mic ports. Okay? For a BTE, we'll also clean the instrument itself as well as the mold. And then we'll remove the tubing. Use our tubing blower to clean the tubing. And then also a vent cleaner to clean the ear mold vent, making sure we get everything. If need be, you can soak this. And then don't forget about those microphone ports. Okay. And for an ITE, you'll use the wipe to clean the body of the instrument again, and the vent cleaner to clean the vent, and then the brush to clean those mic covers. Next, we'll replace some parts. Let's first clear our workspace. And for instruments with disposable batteries, you'll want to remove the sticker and let it aerate for a minute while you are working. So for our right, we will first replace the wax guard. Pop it in and place the new one in. Set that aside, and then replace the dome. Be sure to line up the center and push it on until you hear a little click. For a BTE instrument, you might want to replace the tone hook. So you will push the little pin out, grab it with your fingers, remove it, and put the new one in, grab the pin. And these can be a little bit difficult to work with, so it can be helpful to have a workspace that isn't slippery. And you're good to go. And then for CIC or ITE, you'll be ready to put that fresh battery in. Okay. Next, listen to it. First, we'll clean our workspace and grab our listening scope. Check the sound with different speech sounds. Ooh, ee, ah, sh, Is there any distortion or feedback? And is the amplification consistent with the client's hearing loss? Gently rub the different mic ports. If it's still not functioning and it is a mini right, you can then replace the receiver. You'll take your red pen tool and pop it out and replace it with a new one. Then you'll listen again. If it's still not working and it is rechargeable, you'll want to try and charge it. So place it in the appropriate charger and wait 15 minutes. Then listen again. Ask yourself these questions. Can sound come in? Can sound come out? And does the device have power? If after cleaning the device and replacing parts, it's still not working, it's time to send it in for repair.